So what is burnout? As Dr. Edwards spoke about yesterday, burnout is a work-related stress syndrome that results in emotional exhaustion, reduced compassion and empathy, increased cynicism, and reduced personal accomplishment. So what are the effects of burnout on medical care? These are some of the effects that we see in the research related to medical care. So as we see, burnout can be hazardous for both the provider and the patient. This quote here is from a recent study. Medical provider burnout is turning into an epidemic. National studies suggest that over 50% of providers experience symptoms related to burnout, which is significantly higher than the general population. So this quote brings up some important points. So if this statistic is accurate, half of this room is experiencing symptoms of burnout. Secondly, it raises the question, what is it about medical care, being a medical provider, that leads to burnout? Why is this rate so high among the community of medical providers? This diagram shows what some of the strongest predictors of medical burnout are. And as we can see, the majority of these factors are work-related factors. This is a systemic issue. So if you're one of those 50%, if you're experiencing symptoms of burnout, this isn't some kind of failure on your part. This is a systemic issue. This is a hard job. There are many factors at play, and there are going to need to be many layers of intervention in terms of dealing with and reducing burnout among medical providers. But we also need to make sure that we're taking care of ourselves in order to combat these effects. And one of the ways to combat these effects that's evidence-based is self-compassion. So what is compassion? Compassion has two parts to the definition. So first is a willingness to be present with suffering in ourselves or others. So to be compassionate, I need to be open to whatever the other person is bringing in. I'm communicating to either the patient or myself. If I'm to be compassionate, I'm communicating, I'm open to whatever you're bringing in. I'm making space for your suffering, your sadness, your hurt, whatever it might be. Secondly, there's a willingness to do something about it, or a willingness to act on that feeling or that desire to make space for the patient. So if I'm feeling compassionate towards the person, I'm motivated by their pain, by their suffering, to act on their suffering and to do something to try to alleviate it or try to address it. In terms of self-compassion, that's turning this willingness inward and making space for what we're experiencing, what our difficulties are, and trying to do something to manage it, to address it. Dr. Kristen Neff breaks self-compassion down into these three elements. So first is mindfulness. Inherent in mindfulness is a capacity to observe an experience without over-identifying with it, without getting sucked into it. So I can experience my sadness, I can experience my anger, I can experience my pain without getting overwhelmed by it, without getting pulled into it or spiraling down. Secondly is kindness. I'm being kind to myself rather than harsh, judgmental, or neglectful of what I'm carrying. Lastly is common humanity. So I'm finding connection in my suffering with other human beings. All of us suffer to one degree or another. And so in my suffering, I'm connecting to other human beings who suffer. I mean, in this room, we have physicians who are likely experiencing the symptoms of burnout. You're likely sitting next to someone who's experiencing those symptoms. And finding common humanity is acknowledging that fact. I'm not alone in this. There are other people who suffer like I do. And so this isn't just my thing or my weakness. So what does this look like? So here's an example of a exercise that providers could do at the end of the day to wind down, to digest the events of the day, and just come to terms with what's happened. We all respond to what happens to us, and so giving yourself some time to digest what's occurred can help. So first off, starting with mindful attention to the body, just paying attention to and observing what's going on inside. Yeah, what am I feeling right now? If it's hard to attend to emotion, just noticing, how do my feet feel sitting on the ground? How does my back feel sitting in the chair? So trying to cultivate that observational quality of mindfulness. Next, just sorting through the events of the day. Yeah, what happened today? It doesn't all have to be dark and difficult. Yeah, what went well today? What was hard today? Some examples of some ways to validate or acknowledge to yourself the events of the day. You know what, that interaction went better than I was expecting. Or, I was hoping that procedure would have gone better. We respond to the events of the day emotionally. Our emotions are communicating to us how we're experiencing those events of the day. So part of this is acknowledging the events of the day, but then acknowledging what's happening inside related to the events of the day. You know what, I feel proud that went better than I expected. Or you know what, I feel sad, or I feel angry, I feel frustrated. Just acknowledging the breadth of emotions that might be there related to what's happened that day. And lastly, letting your emotions guide what you need. Yeah, what are my emotions telling me that I need right now? Maybe I need to advocate for myself. Maybe I need to speak up about how much this is affecting me. Maybe I just need to sit with the sadness of that last interaction and hearing the difficulty of what that patient has to carry. Yeah, maybe I just need to sit with this for a moment. That kind of feels good. And so just letting your emotions and your own reactions to what's happening guide what you, educate you on what you feel like you need. In terms of benefits of self-compassion, there have been a couple studies of compassion trainings for medical providers where they've undergone compassion training, and these are the benefits that they report. And as you can see at the bottom, so reduced burnout is one of the most consistent findings among self-compassion training in the literature. And so if you're experiencing symptoms of burnout, this may be an intervention or this may be a practice that you might implement that may help reduce or combat these symptoms. If you're interested in cultivating this skill of self-compassion, here's some places to start. Selfcompassion.org is a great resource. There's a free assessment. You can assess your level of self-compassion on the website. There are also several guided and written exercises that you can engage in. The two compassion-focused programs that I'm most familiar with are the Mindful Self-Compassion Program and Compassionate Mind Training, and these two workbooks pertain to both of those programs if you're interested in developing these skills on your own. So in summary, burnout is a huge issue. And if you're one of the 50% that's experiencing burnout, I hope that you can find a way to combat these symptoms, to work with yourself, to take care of yourself, so that you can provide the best care for the patients that you serve. Thank you for your time.